A similar scene today at UCSF. The first doses of the vaccine were given there. Dr. Tomás Díaz, an ER doctor, was fourth in line this afternoon. Dr. Díaz has been on the front lines treating COVID patients since the beginning of all this back in March. Dr. Díaz joins us this evening. Dr. Díaz, thanks for your time and good to have you back on the program. A few hours later now, tell us, you just got that shot. How you feeling? What are the side effects?
Yes, hi. Thank you for having me. And I feel great. You know, physically, I don't feel any different than I did prior to getting the injection. Spiritually, I think I feel, gratitude, hope that this is putting us on the path to getting out of the pandemic.
Hey, doctor, can we ask you this as we move forward here? You grew up in an immigrant community in New York, Dominican and Cuban. There's a lot of mistrust in communities of color. What's the plan for you on a local level to get as many people as possible vaccinated, including the minorities?
No, yeah, absolutely. There is definitely fear and mistrust among some members of marginalized communities. And, I'd like to acknowledge that fear and that mistrust is not invalid. There has been a lot of harm enacted by the institution of medicine against these communities. That being said, I'm hopeful that, the visual of me and others like me getting the vaccine can provide some reassurance to folks and can also serve as a reminder to medical institutions of all the work that is left to be done to regain that trust. And so there are definitely folks on the ground trying to reach these communities and make the stories personal about vaccination.
I was just going to say the Tuskegee study is a horrible example of what so many people went through. In terms of the black community specifically in San Francisco or Oakland or anywhere in the Bay Area, when you say local outreach, how can you do that?
Yeah, so in terms of people are on the ground working with community members, really just trying to get out information, but again, even beyond the information, acknowledge the mistrust, acknowledge the history, and provide our stories and our expertise.
Dr. Díaz, how long will this how long will this vaccination last? Is it similar to a flu shot that we just took today? Will you need to do it again next year? Will all of us need to do it repeatedly?
So unfortunately, I don't know that we have that information quite yet. I can say obviously that I will be getting another dose of this vaccine in 3 weeks. But beyond that, in terms of just how long the immunity will last, time will tell.
Are you getting burnt out? You've been doing this since March. You even went to New York to help backfill some of the hospitals in the spring. Are you getting burnt out, you and your colleagues?
You know what, I think there is, a little bit of exhaustion there, but I think the news of the vaccine and now actually receiving the vaccine, I think there's been a lifting of spirits and again, can see a bit of a light at the end of the tunnel, which makes us all very hopeful.
Dr. Tomás Díaz, we appreciate your optimism and your insight here tonight.
Thanks for having me.